Hi everyone, thank you for joining us today. I am joined by my colleague and friend Cameron Friesen, who is our Minister of Health, Seniors and Active Living. I'd like to take the time today to acknowledge so many community partners who are stepping up, helping other Manitobans during this time of need. The town of Lac du Bonnet hosted a teddy bear hunt. They encouraged all their community members to put a teddy bear or a stuffed animal in their front window for children and their families to see while they're out for a walk or a drive. Thank you for doing that. The Dynamo Girls Club volleyball team are using technology and social media to host team bonding events and challenges to do their best to stay active. And to date, we have seen more than 5,500 volunteers sign up for Help Next Door Manitoba, right across the province, close to 160 cities and towns all over the province of Manitoba. So I want every Manitoban to know how proud I am of them for stepping up, for working together, for helping their neighbors and taking every precaution necessary to help each other overcome these uncertain times. It is vitally important in unprecedented times like these to ensure our healthcare system is able to quickly respond and adapt to ensure the health and well-being of all our citizens. This pandemic will undoubtedly place extra strain on our healthcare system, and we must do everything we can to ensure it's there for us and our loved ones, not only today, not only during these times, but in the future as well. We must do everything we can to support our frontline workers too. Our healthcare workers are our heroes, and we have to prepare for the hard work ahead, and that hard work, much of it will be done by frontline healthcare workers. We thank them too. Il est important en des temps sans précédent, comme celui-ci, de veiller à ce que notre système de santé soit en mesure de réagir et de s'adapter pour assurer la santé et le bien-être de tous ses citoyens. Cette pandémie mettra sans aucun doute une pression supplémentaire sur notre système de soins de santé et nous devons faire tout notre possible pour nous assurer qu'elle est pour nous et nos proches aujourd'hui et à l'avenir aussi. Nous devons faire tout notre possible pour soutenir nos agents de santé de première ligne et nous préparer au travail à venir. Resiliency matters. Our healthcare system always matters, now and forever. Together, we're dealing with extraordinary measures and extraordinary times, and today, the Minister of Health, Seniors and Active Living will be announcing steps to increase our nursing capacity on the front lines as we face this pandemic together. Cameron?
Thank you, Premier. Good afternoon, everyone. As we know, we are in unprecedented circumstances during this pandemic. Our government recognizes the incredible strain on our healthcare system as a result. And so first we stop to say thank you to healthcare workers and all Manitobans, and healthcare workers who have stepped up, who have reported for duty, who are protecting people, who are serving their patients each and every day during this COVID-19 epidemic. We have seen what has happened in other jurisdictions when preparation is insufficient. And that is why Manitoba is taking action to ensure that our healthcare system is ready. We've been working in collaboration with colleges, including the College of Registered Nurses, with labor unions. We all recognize the need to enhance our current system, including our current workforce. And we have found a way to invite nurses in our jurisdiction back into the workforce, including former registered nurses. Today, I am pleased to announce that I am issuing a directive under the Regulated Health Professions Act. This order enables the Registrar of the College of Registered Nurses of Manitoba to waive or modify registration requirements for former nurses, to essentially fast-track their return to practice during this pandemic. Aujourd'hui, nous sommes fiers d'annoncer que nous prenons d'action pour permettre aux infirmiers et infirmières un chemin, une façon de retourner au système de soins de santé, de retourner sur le marché du travail et soutenir les efforts contre COVID-19. The nurse returning to practice must have been a member of the college in good standing with authority to practice within the last 5 years and must be able to safely provide care. I would also add the registration fees for nurses will be waived during this process. The college is underwriting those fees. The province is contributing a portion of the fee, and as a result, there is no cost for a former nurse to re-enter the workforce at this time. This will allow nurses more easily to come back and help out, to be part of the effort without paying licensing fees. Our government is taking action in a timely way. We know that now is the time to broadly solicit for help. And I'm not just talking about former registered nurses, but also nurses who have returned from other jurisdictions to Manitoba as well. To those nurses in Manitoba, we say if you fit these criteria, we are asking for your help. This could be nurses who are working part-time. This could be nurses, as we said, who are recently retired. This could be nurses that are teaching at the moment, who are working in administration. There are many other examples of support being expressed each and every day by Manitobans in the fight to flatten the COVID-19 curve. As previously announced, we reached a memorandum of agreement with Manitoba nurses. Both groups came together to find a solution for a contingency plan that would provide certainty and ensure that staff will be there for patients and to ensure that patient safety comes first. We are also prioritizing screening and COVID-19 testing for nurses. Manitobans know that we have prioritized childcare spaces dedicated to frontline healthcare workers, including nurses. I also want to recognize 94th-year nursing students working at HealthLinks InfoSanté, and also undergraduate and graduate students from the University of Manitoba are assisting the work at Chatham Provincial Laboratory and the public health work that is going on there. As well, a big thank you to the almost 100 doctors who have now already stepped up to take on additional hours at clinics and hospitals. We are continuing to work with our federal partners on the issue of the personal protective equipment for nurses and frontline staff. We are acting out of an abundance of caution. Our government and healthcare leaders are working cooperatively. We have taken numerous measures to keep Manitobans safe. We will continue to update Manitobans as we take action in an ever-evolving circumstance. Once again, in closing, I thank all Manitobans for their efforts. I thank them for their cooperation, for their compliance, for the orders that we are issuing, and for their compassion and the ways that they are reaching out and reaching across the distance that COVID-19 creates. Thank you, Premier.
Thank you, Cameron. Thank you on behalf of all of us for your work and for the work of your team and your department. You've been leading the way. I want to say also thank you again to our frontline healthcare personnel, selflessly dedicating their time, their energy to the front line of this health pandemic. We're taking these steps in partnership with our frontline workers and our healthcare leaders so that we can protect our most valuable service, our healthcare system, today and tomorrow. And we're doing that so we can protect people when they're vulnerable and when they need that system to work, and they need it to work now, and they will always need it to work. I have no doubt that many retired nurses are going to want to come forward and support their colleagues, and I thank them for that. This is a difficult and unprecedented time, but I know that nursing is a caring profession, and I know that nurses are caring people. We're going to flatten the COVID curve, and as we do, we will ensure that all of us and our loved ones have a healthy Manitoba today and also sustainable Manitoba going forward. So to all Manitobans who are doing the right thing, protecting themselves, protecting others, remember, not every generation has the opportunity to save a life, but you do. Stay positive, encourage one another, help one another. We will be back. We've been the home of hope for over 150 years now, and we will continue to be the home of hope. And together, we will beat this thing.
Thank you very much. A reminder to the reporters online, you will have your primary question and a follow-up. First, we go to CBC Manitoba and Bart.
Bart Butita, CBC Manitoba. Minister, can you please comment on the transmission of the virus within the healthcare system? We now have at least 3 confirmed reports of healthcare professionals contracting COVID-19.
Yeah, thank you for the question. So we know this is not ideal. It's not ideal to have nurses and other healthcare workers who are suddenly finding themselves facing a 14-day isolation order. I can tell you that it's a quickly evolving situation. We know that this issue has been faced in other Canadian jurisdictions and indeed around the globe. We're taking action. Your Chief Provincial Public Health Officer will be behind this microphone in shortly from now, and will be providing a full update on how we're taking action to protect those who are serving us in our healthcare centres.
Follow-up for you. Some larger Canadian provinces are building temporary hospitals and doing other things outside the hospital structure. We know Manitoba is looking at placing some COVID patients in hotels. What does Manitoba plan to do to expand hospital or treatment infrastructure outside of physical hospitals in the event that this surge, to prepare for the surge that's coming?
So there's significant efforts, as you know, underway in hospital to create and to expand the capacity that we have. While that work continues and is proceeding very rapidly, we're pleased to know that those plans are in place. But as you say, those plans are not limited to what we could do in a moderate event. We are in every case hoping for the best while we plan for every eventuality. The plans that you reference are indeed being worked up.
Just clarify there, you mean temporary hospitals?
That's correct.
Thank you.
Next, we have Mark from City News.
Hi there, Mark Neufeld, City News. You said now's the time to broadly solicit for help. Is that because we are expecting more frontline workers are going to be contracting COVID and they'll be pulled off for that 14 days, and this is a way to sort of get a backstop ready before that happens more frequently?
Backstopping is an important way that we prepare. It's not the only way we prepare, but certainly we've said that we are pulling out all the stops when it comes for making our system ready, and one of the ways we will do that is to solicit for that help from people who have been in our system. It's an important way. We've already had expressions of support of former nurses who want to help out in this way, and so we're pleased to be bringing this action in conjunction with the College of Registered Nurses of Manitoba to create the pathway for those outside of the system to re-enter it.
Let's be very clear though, Mark. This announcement today has been in the planning stages for a number of days. It isn't in reaction to an event at Selkirk or any other event. We've anticipated that unfortunately was going to be the eventuality, as it has been in virtually every other jurisdiction where unfortunately healthcare professionals on the front line occasionally are going to be exposed. So this is not to be linked to the event of yesterday. This has been in the planning stage for the last few days.
You talked about over 5,000 volunteers helping to step up. I know businesses are also helping supply items like surgical gloves, surgical masks, and IV pumps. Do you need businesses to provide specific items right now more so than any other?
We certainly do. It's why only days ago we announced the opening of a portal, an internet portal for business, manufacturers, retailers, industry to be able to signal that they could provide goods or services that we need. We created a list, a detailed list of what we're looking for. Certainly we're working with our federal cousins on these issues, but our efforts are also unique in jurisdiction. We are leading those efforts, and only days ago we found ways to resource that work with a new table that's leading that charge to engage people to say, here's the supplies we need, and we need them now.
I'm very proud of the small business community in our province for stepping up. In some other jurisdictions, nationally, internationally, governments have had to resort to other approaches to ensure capacity or procurement. But here we've had tremendous response from our small business community. These are people who are really demonstrating their sense of duty and citizenship to us.
From the Winnipeg Free Press, Carol.
Hi, Minister Friesen. Have you been briefed on how many hospital workers have tested positive and are self-isolating, and what measures are being taken to protect the frontline healthcare workers now?
So I do receive those briefings daily. There are still some numbers emerging today, but as it was previously referenced, there were 3 incidents in which someone came to work sick. And as a result of that, there was possibly transmission to others with whom they came in contact. Now, the Chief Provincial Public Health Officer will be here shortly to detail significant plans that we will put in place immediately going forward. We have said that as a government and as a key healthcare leadership group, we plan to do everything we can to keep healthcare workers and those in hospitals and healthcare settings safe, and we plan to do exactly that.
My follow-up question is for the Premier. Premier Pallister, late yesterday I noticed about a person with COVID-19 at Club Regent on March 16th was posted online by Public Health. Are you disappointed that the public wasn't made aware of it until 15 days after the person was at the casino?
I think this is probably a good question as well for Dr. Friesen, Carol. The notification protocols we've been following and the rules we've been following have been on the basis of the advice of our Chief Medical Officer as a professional in this field, and so we'll continue to respect that expertise and to act accordingly.
From CJOB, Diana.
Good morning, Diana Foxall from 680 CJOB. Mr. Premier, we have video of someone selling N95 masks kind of on the black market. The shot shows someone kind of pulling up to the apartment in the middle of the night and buying a box of the masks for twice the price they're going for. And obviously these aren't going for healthcare workers. What do you make of people profiteering on these much needed supplies when obviously the demand should be going towards healthcare workers?
Well, I'll look forward to getting the evidence that that's happened, and we'll act accordingly here. I think if it's conduct that you've described, it's shameful and disappointing. It goes counter to everything that I'm seeing from the vast, vast majority of Manitoba citizens who are respectful of the needs of our frontline workers to offer the services that we depend on in healthcare and want to make sure that they're protected first and foremost. Obviously, all of us are concerned about the safety of loved ones and ourselves, but the need right now has to be to protect our most vulnerable people. And our most vulnerable people are being treated by healthcare workers on the front line who need those supplies. So forward me that information, and we'll take the appropriate action ASAP.
And just as a follow-up, what kind of action would the province take? What kind of measures would we be talking about as far as cracking down on anyone selling these kind of things on the black market?
Well, it's the first I've heard of it, so I'll tell you when we get the information, and then we'll probably talk about it tomorrow or in the next 48 hours.
From Global, Brittany.
Good afternoon, Mr. Premier. At the beginning of this press conference, you started talking about some teams that were calling in or video conferencing in, doing some team bonding. Well, we've noticed, there's some other areas where people are still not practicing social distancing, football practices that are still going ahead at some schools, whether they're school sanctioned or not. Toronto has brought in fines. They started issuing those a couple days ago. $750, I believe, was the fine people were being given if they weren't abiding by those gathering regulations. Are we going to start seeing it being cracked down on here in Manitoba?
Well, I'll continue to examine any issue you bring to my attention, whether it's from the media or other sources. We have now some call-in numbers and so on. But I have to say, in the first instance, this to the young people of our province: Understand that previous generations fought and gave up their lives to protect their fellow citizens. Manitoba led the way in people volunteering for service in both the First War and the Second War. Young people did their part. They stood up and they did their part. And you have the chance to do your part now and protect yourselves, but protect other people too. Okay? So you're vulnerable. Other people are vulnerable. Follow the directives. Make sure that you're careful. Make sure that you respect each other, and make sure that you respect the people around you. You can save a life right now by listening. Listen very carefully to these directives. Abide by them. Because no government's going to stop people if they're all unwilling to listen. The fact of the matter is we need you to listen now. We need everybody to listen. If there are people coming back from abroad, isolate immediately. Self-isolate. Think of it as a quarantine. I don't like to hear these reports. No Manitoban likes to hear these reports because this is disrespectful to each other. This is not what good citizenship looks like. Listen carefully. Understand this is real. This is not pretend. This is not a video game. This is real. You have the chance to save lives. Do it. Listen and act accordingly and respectfully.
And my follow-up on that, we know you've spoken pretty sternly about us all working together to flatten this curve. Is it going to take cracking down, issuing fines, and making sure that people know we're serious about this for people to actually listen?
I would hope, Brittany, that it doesn't come to excessive measures. We have the opportunity to some degree with the state of emergency we've declared, the health emergency we've declared, to take actions beyond those we have taken. That is true. On the other hand, I have tremendous respect for the people of Manitoba, and I can tell you that whatever success we've had in withstanding or delaying or flattening the effects of COVID-19 is because of the citizens of Manitoba being caring people. And no amount of big government is going to change the nature of some people, I suppose, but we are doing our very, very best to make it clear that with the messaging we've been giving in many different ways, consistently, that this is in our hands as people. So I won't take off the table the possibility of further actions if people are blatantly abusing the rights and freedoms they have to come to take for granted in some cases. I understand we respect those rights, but we also respect the right of people to be protected at times like these, and we need people to follow these directives that we're laying out very, very clearly, that all of us are laying out very, very clearly.
Thank you.
You bet.
From the Brandon Sun, Drew.
Thank you. This is Drew from the Brandon Sun. And Mr. Friesen, does Manitoba Health have any estimates of how many nurses that the measure announced today could bring back into the system?
So we continue to work with the college and other sources to determine how many nurses may respond to this. And certainly we need the college to amplify this message. We need nurses themselves to amplify this message, to work with their networks, the people they know, to tap someone on the shoulder and say, now's the time. We've made it easier than ever with these measures, removing barriers to get nurses back to the workforce. But I can tell you that we've already received these offers of support. And we know in other provinces, thousands of these types of offers have been received by nurses who want to come in and join the fight on COVID-19.
And just as a follow-up, but for the nurses who do come back, will they be distributed around the province according to need, or will they only be practicing where they live or where they're previously working?
So there's a broad variety of options, and when we think about how we could deploy nurses coming back from retirement, these might be people that we use on telephone lines at health links. They could be people that we put in wards. Those determinations will be, of course, made by our system leaders and administrators to know best how to deploy this resource. But it's clear that we are saying at this point, all hands on deck. It's been said many times that nursing is a calling, and a calling that doesn't ever really leave. And so we know that many nurses at this time are going to say, all hands on deck, I'm willing to step up and join this fight.
Thank you.
From the Winnipeg Sun, James.
Good afternoon, James Snell with the Winnipeg Sun. A question for Minister Friesen. I'm wondering if we will reach a point with the addition of new healthcare staff that we will attempt to dramatically expand testing for COVID-19 beyond those who are symptomatic.
So testing is important, and it's why we've put a lot of emphasis in trying to improve our daily testing at our Chatham Provincial Laboratory. I can update you on that and indicate, while I won't give away the message of Dr. Friesen, who will be here in a few minutes, that testing is up again. The lab has been working very, very hard, and even today we'll be joined by additional efforts. And as of today, Dynacare Laboratories has found a way to even assist further our efforts on the number of daily tests that are able to be processed. We recognize that testing is necessary. It's why we've opened up so many screening sites. The lab is working hard, and we also want to say a shout out to all the people who are working not just on the front line, but behind the scenes in areas like Chatham Laboratory to make sure that this effort is having effect.
I'd note that we remain among the Canadian provinces' leaders in terms of the number of tests that we've done. We continue to focus, of course, on the most vulnerable cases first, and we'll continue to make every effort to do what we can to alleviate the concerns many have about whether or not they may be infected, obviously, with the methods the doctors outlined and Cameron's outlined.
Thank you very much.
From the Canadian Press, Steve
Lambert from the Canadian Press. Premier, I know you've already announced a couple of measures to help people who might be having a hard time making the rent in this new situation, but those measures include a rent freeze and a freeze on evictions. You've hinted that more might be on the table, but now that it's the first of the month and we're hearing that people are having a hard time making their payments, are you going to offer any direct aid to renters?
Let's be clear, we've taken steps, other provinces have as well, to give greater security to tenants here in Manitoba, to protect them against eviction, apart from evictions based on criminal activity or unlawful activity and that type of thing, and also to give them the assurance that they want to have that their rents won't be raised inordinately and put them under greater financial challenges. But let's also understand that renters alone don't bear the brunt of facing the challenges that we have as a province. Everyone is facing these challenges to some degree. Some have seen their life savings eroded. Others who own small rental properties have the same bills they had before, with tenants who are having difficulty paying them. Small businesses have been forced out of business because of decisions we have had to make to protect the health and well-being of Manitobans. Our civil servants, many of them are working double time on a number of projects. Our frontline workers face amazing challenges. All of us are under stress. We're all in this together, so let's understand that we're going to be supportive of actions that will address the most vulnerable people first, that will stand up our healthcare and social service systems to protect all of us, because that is what is under threat right now, and that will work in partnership with other levels of government, including the federal government, that's announced, I think, a very appreciated program that we'll be helping to promote and deliver to assist on filling that gap in the valley up ahead that we all see coming, to provide income supplements and support in addition to or adjacent to things like our employment insurance program that we've been funding for many years. So we're all in this together, and we all need to remember that as we encounter the challenges and as we face the challenges together.
And a follow-up question, somewhat related. Bad weather's coming this way. We're approaching the flood season. Have you asked for any help from the federal government in terms of reservists or other bodies to help with sandbagging and other tasks that social distancing might not permit normally?
Our preparatory work is well underway. We, as Cameron alluded to earlier, and it's a slogan, but it's true, we're preparing for the worst and we're all hoping for the best. The fact is that our flood forecast will be out, I think, in later today or tomorrow. And so you'll have the ability to ascertain whether that's an additional cause of stress or not. But one thing is certain, we're working in partnership, strong partnership with our municipal partners who will be at the front line if needed in the event of a flood. And we're working very cooperatively with the federal government, who I thank for that cooperative tone on a number of other fronts as well. So we're preparing for any eventuality. But again, our first concern will be protecting our most vulnerable citizens, and right now that is protecting people who need our healthcare services, and that's what this announcement today is frankly all about. It's about making sure that we have that ability to sustain those services that are so important when they're needed.
From CTV Winnipeg, Jeff.
Hi, it's Jeff Keel, CTV. Is there any discussion about mandating nurses and retired healthcare workers back to the job?
Well, we are pleased to have previously signed a memorandum of agreement with nurses, with Manitoba Nurses Union in this province. That's a more collaborative exercise that does allow us to, if needed, direct nurses where most needed in the system under very, very irregular circumstances like these ones. But at this point in time, there has been no action that I'm aware of in any jurisdiction to take people outside of the workforce and compel them to come back. What this is it's a signal, it's an offer, we're opening the door, we're removing the red tape, we're eliminating the fees. We want those former nurses to come back.
Mr. Minister, on a follow-up question. We've seen what's happened in nursing homes in other provinces. What is the province doing to protect outbreaks there, and do workers in these nursing homes have enough protective equipment?
So every day, the issue of personal protective equipment is a focus for our government, as it is for all governments. As the Premier said, we continue to collaborate with the federal government. We are looking for further details about when we can expect the delivery of personal protective equipment into our jurisdiction. We need that in a timely way. We have sufficient supplies for right now, but we will require additional supplies. For personal care homes, of course, we suspended visits there more than a week ago. We have been issuing messages to say that everyone needs to be very prudent. We're speaking with labor groups about concerns being raised about what happens when someone might work in 2 personal care homes, and we're working through some of those detailed problems as well. I understand that additional messages were sent today by the Chief Provincial Public Health Officer to ask those personal care homes to redouble their efforts and to raise that bar when it comes to keeping people safe, because we know that is a significantly vulnerable population that we must protect.
From CDC Radio Canada, Patrick.
Yes, hi, Patrick Foucault from Radio Canada. First of all, thank you to both of you for providing French statement again earlier. That's very appreciated. So I guess my first question would be, and you can absolutely answer in English if you're more comfortable. Will Manitoba force in bed and breakfast and rental cottages to cancel reservations like we saw in Quebec?
C'est la première fois pour cette demande, pour votre demande. Congratulations, félicitations. At this time, I have no answer for your question. I'll look into it and we'll provide you with an answer.
All right, and I guess my follow-up question would be also a follow-up to Steve's question earlier. So we have viewers here who are saying that their landlords still increase their rents this month, even if you ask for a decrease of rent. So what would you suggest? If you could talk to these tenants, what would you suggest they do, maybe in terms of a legal approach?
Well, I think I talked to them rather clearly yesterday in saying such decisions are inappropriate at this point in time, and I think that already I've got reports that landlords have responded appropriately and adjusted their practices, so we'll hope that that behavior continues. Clearly, this is not a time to add uncertainty to the already existing stress.
Lastly, we have from APTN National, Brittany.
Good afternoon, Mr. Premier. Brittany Hobson with APTN National News. Several First Nations chiefs from up north have put out a call out, I guess, to close down highways, specifically Highway number 6 to non-essential travel. As we saw our first case of COVID-19 in the north, I think that had some people on edge. What would be your response to that? Is that something the province would consider?
I think you were cutting out on me a little bit, but I'll do my best to answer what I think the question was. I think it was something about restricting travel within the province of Manitoba itself, and that is not on the table at this point in time, and nor is it on the table interprovincially at this time, apart from the existing stations we've established, 5 on the border with Saskatchewan, 1 on the border with Ontario, for checkpoints and for distribution of instructions to assist us in making sure that we're protecting our province in respect of those who come into the province, and giving them clear instruction on what they are mandated to do. Internally, I think that the practice we have adopted to this point in time of really pushing the educational piece so that we all understand how to protect each other. And when I say all of us, I'm saying that hopefully. I'm addressing that at people who want to practice football and others, to make sure that all of us understand that we have an obligation to protect ourselves and one another at this time, and to make sure we follow that. But at the same time, we are all mindful of the challenges this creates for people in rural and north. I grew up in a rural community, as you know. I didn't grow up in a rural community. I grew up on a farm 15 miles from a rural community, and I understand the challenges this creates for northerners, and as well in terms of accessing supplies, of being able to get the services that they need so they can sustain themselves, so they can protect themselves. And so at this point in time, apart from the educational initiatives that we've undertaken, we're not looking at restricting travel internally within the province of Manitoba, out of respect for the very real challenges that we're creating for people, not only in the city of Winnipeg, but in other communities around the province and in the rural and northern areas as well.
Just to follow up there, just to confirm that you wouldn't look at setting up possibly more checkpoints in northern Manitoba. Well,
again, I understand that a couple of communities, and I'm looking forward to having another chat with our community leaders, Grand Chief Dumas and others, around other pertinent issues. We have exchanged information, but I'm looking forward to personally chatting. In any case, some of the First Nation communities I know, out of an abundance of caution, have done blockades on their communities. I think more as checkpoints. I was visited Long Plain First Nation on the weekend just to do a kind of a visual check, and I understand they were also doing informational distribution within the community to protect residents there from people coming in who may have been a risk or posed a risk. So I see various First Nations communities taking measures to protect their people. I respect their right to do that. But at this point in time, again, not additional blockades internally within Manitoba. The reinforcement of the messaging and the reinforcement of the checkpoints on our borders with Saskatchewan, of course with North Dakota and with Ontario, very much an emphasis at this point in time.
Thank you.
I want to say again, at the risk of having to, at the risk of going too far here, I don't want to go too far. I just want to say thank you to the members of the media for your diligence and work too, because frankly, we need to understand that without the work of the media in our province, the messaging that we're trying to get out there about public practices better designed to protect each other wouldn't be getting out as effectively. And so I want to say thank you to you for that. We're going to have a special event tomorrow just for children, a call-in that'll, I hope, assist families dealing with stress, children dealing with stress at this time, to get some answers to questions, to share their perspectives, Yesterday, I made the recommendation to children not to share those sippy cups and not to share their musical instruments. I want to say a special thank you to little Nick, who sent me his picture with his trombone in his hand and said he was keeping that trombone to himself. I appreciate that, Nick. Thank you. Keep up the good work, because we're all in this together. And when you do that, you protect your brother and sister and your mom and dad too. So keep up the good work, Nick. And for all of you, remember that we appreciate your work right across the province. Keep a steady hand, keep calm. Remember that by working together, doing the right things, you can save a life and we can beat this COVID thing. Thank you.